Good afternoon, and thank you for joining us for today's webinar, The Rare Sibling Experience. My name is Paige Evans, and I'm the Education Programs Coordinator at NORD, and we are glad you are here with us today. Before we get started, just a brief word about NORD. For over 30 years, NORD has led the fight to improve the lives of those with rare diseases. We do this through education, research, advocacy, and patient services. To learn more about NORD or to access our resources and events, please visit our website at rarediseases.org. You can also follow NORD on Instagram, Facebook, and Twitter. This webinar is being recorded, and we will make it available to all registrants within the next few weeks. At that time, please feel free to share with anyone who is not able to join us today. This is an important topic, and our hope is to include as many voices as possible in this ongoing conversation. I'm now going to turn it over to our guest moderator, Eden Van Olstein.
Hi, everyone, and thanks so much, Paige. Again, my name is Eden Van Olstein, and I am a child life specialist at the Children's Hospital of Philadelphia, and it is my pleasure to be your host for today's webinar. For those of you who aren't familiar, as a child life specialist, we provide psychosocial support to patients and their families as they go through diagnosis, treatment, and disease maintenance. And when we look at the whole system and the whole family, really something that is near and dear to the work that I do and the work that we do is helping support siblings along that journey. I've been a child life specialist for almost 10 years, and 8 of which I spent in the cardiac center helping support patients through their outpatient journeys. And I think it's been really, really important for me, and I realized very quickly that siblings were just as inquisitive and wanting to know what was happening for their brothers and sisters as the patient. And so I really think that the work that we've done in helping these patients and their siblings understand what's happening, it gives an opportunity for those healthy siblings to ask questions and clear up misconceptions. So I'm really grateful for the work that we do and the opportunity to support many children along their journey. And then many families in the rare disease community have multiple children, and so parents often seek guidance on how to best support all of their children, not just the patient with a rare disease, with intention and empathy. Siblings can also benefit from counsel on how to form a meaningful connection with a brother and sister with a rare condition. We've received many thoughtful questions submitted during registration, and NORD is honored to have a panel of speakers today who can address this topic from various perspectives. Our speakers today include Dr. David Rintel from BridgeBio. He's a psychologist and a rare sibling. We also have Kate Mcgowan. She is my counterpart here at Children's Hospital of Philadelphia and also a child life specialist. And lastly, we have Hannah Raskin-Gross, who is a rare sibling herself and also a congenital hyperinsulinism advocate. I'd like to now get started by asking each of our panelists to take a few minutes to briefly talk about what it is that they do and to share their professional and personal connections to the rare sibling experience. David, let's start with you, and then we'll hear from Kate and Hannah. Please tell us a little bit about what you do and how it relates to today's topic.
Very happy to, Eden. First, let me thank all of the panelists and for NORD for producing a webinar addressing this population, because I think siblings of children with all types of long-term medical illness are often overlooked by healthcare providers, by clinicians, by mental health providers at times, so it's really wonderful to address it. So I work in patient advocacy at BridgeBio, and I have the pleasure and honor to work with many leaders of patient organizations in a number of rare conditions. BridgeBio has over 20 research programs in genetically based rare disorders, and I work with advocates who represent the community for Canavan disease, for congenital adrenal hyperplasia, for PCAN, for propionic acidemia, and achondroplasia, among others. My background is that I had a pretty full career as a psychologist before I went to work in patient advocacy in industry, and my specialty was working with families who are living with chronic medical conditions, mostly neurological conditions like multiple sclerosis. I also worked in a pediatric multiple sclerosis clinic at Mass General Hospital, so often met siblings of my patients there. And I have a particular interest in, have done some research on children who have a parent with a chronic illness, and in doing so have learned a lot about how children perceive medical illness in the first place. So My sister has Gaucher disease, but let me just point out that she was diagnosed in adulthood, so I did not grow up as a rare sibling in childhood.
Thank you, David. Kate, would you like to go next?
Sure, thank you. My name is Kate Mcgowan, and like Eden said, I am also a child life specialist at the Children's Hospital of Philadelphia. And I too want to echo the great work that NORD is doing, echo my appreciation for the great work that NORD is doing. I have been passionate about brothers and sisters of hospitalized children for a long time, and this is very important work. So I'm honored to be on this panel. I was a child life specialist in our hospital's day medicine and apheresis units, where we oftentimes saw children with genetic or rare diseases. And from there, I transitioned into an inpatient pulmonary unit, where I spent the last 8 years of my career so working with children with cystic fibrosis and supporting their brothers and sisters. Recently, in the last 18 months, I've taken on the role of supervising some of our child life specialists and activity coordinators that all work to support our medical inpatient units here at the Children's Hospital. In addition to my work as a child life specialist, I have also been a longtime volunteer of the Hole in the Wall Gang Camp, where I have volunteered with the Brothers and Sisters program that runs their session every summer. At the end of the summer, they designate one whole week to the brothers and sisters of kids with long-term chronic illness. And finally, what qualifies me to be able to sit on this lovely panel is I support the sibs program that we run here at the Children's Hospital. So that is a program that is designed exclusively for the brothers and sisters of our patients and families. We offer a support session on Saturday morning, 6 times a year. Parents are invited to attend a parent group, and we focus on just some of the issues, but also the really great strengths that our brothers and sisters face as kids connected to the hospital and medical environment. So it's a pleasure to be here today.
Thank you, Kate. Hannah, we would love to hear from you next.
Wonderful. Thanks so much, Eden. Hi, everyone. It's great to be here. Thanks so much to NORD for having me. And thanks as well to the other panelists for being here. Like I said, really thrilled to be here. So my name is Hannah Raskin-Gross, and I am a rare sibling. My younger brother, Ben, was diagnosed with a rare disorder called congenital hyperinsulinism about a week after he was born, when I was 2 years old. So I have lived with this basically for my entire life. As a result of his condition, he's faced a number of challenges and developed a number of developmental disabilities because of it. So I'm happy to talk a little bit about that later. But overall, Ben is a wonderful human being. I'm so thrilled that he's my brother, and I'm really happy to share about him today. I have a whole family that's very involved in the rare disease world, and I'm really fortunate to be involved with an organization called Congenital Hyperinsulinism International that supports people with this rare disease all around the world. And I've been involved with that since its inception. And for work, I work at a nonprofit that works to reform the criminal legal system. And I think there are a lot of overlaps there. So yeah, thanks so much, Eden. Thanks, everyone.
Thank you, everyone. It's wonderful to hear all the great work that you're doing and how somehow our paths have all crossed and come together for the webinar today. So for the next part of our panel discussion, we're going to talk a little bit in different categories around some of the questions that were submitted ahead of time. And so many of the people in our audience today are parents of newly diagnosed children or have younger children who do not yet understand their siblings' diagnosis. We've received multiple questions, as I mentioned, on how and when to explain a diagnosis to young children. So the first question, I'm gonna send this one to Kate and you, David. The first question is, how should I explain the rare disease diagnosis to my healthy child? Should this be done privately with family or with only experts such as child life specialists, psychologists, etc.? Is it better to do that with just our family or to really broaden the information and communication session with others?
I'm happy to jump in to start us off, David. if that works for you. I think, my motto has always been to give kids open, honest, concrete information, which can be really hard when we're talking about some of these complex genetic or chronic rare diseases. And so having the right words to talk about that can oftentimes feel really intimidating and daunting for parents. And I always just like to say that, you are really experts at knowing your children, and sort of the depth of information that would feel overwhelming to them, or the amount of information that might feel really satisfying for them to know. We know that kids in the medical setting oftentimes feel a sense of loss of control because the doctors and the nurses and the medical team members are having these lofty conversations above them or around them. So I really encourage families to include their brothers and sisters, their healthy siblings in the conversation. And I think that certainly you can lean into staff members like child life specialists or psychologists, social workers, caseworkers, who are all part of the healthcare system. But I also think that parents really do know their kids and can feel confident in knowing just what and how to say. I also like to do a shameless plug for children's literature. As a former elementary school teacher, I think that kids can really glean a lot from children's books that maybe aren't directly related to their specific diagnoses, but can help open the conversation around thoughts and feelings and emotions and some of those scary topics that we have to tackle.
Thank you, Kate. If I could add a few words. First of all, allow me to acknowledge that we are really speaking to the experts, which are parents of children with rare diseases. So certainly for my comments, all of these should be taken or not taken, depending on their usefulness to you. So the first answer to the question of when to start talking about the rare disease that a child sibling has, I would always say yesterday. In other words, as Kate said, to keep the well sibling informed in some way, because we know from research is that lack of information increases anxiety in children rather than being informed. And families do this very differently. So you may want to have a professional with you when you explain it. You may want to take some private time. You may want to talk about it as a family together. I think what's most important is to think about what your child knows about illness at their age and level of curiosity, because there has been some really good work on the developmental understanding of illness in children, and that would be the topic of an entire separate webinar. But pay attention to how your kids are talking about illness and ask them some general questions about what they think causes something like a cold. Of course, we're all talking about an illness now, which is COVID, and so listen to how they may be talking about COVID and what it means to them. Of course, COVID-19 is very contagious. Children often learn fairly early that illnesses can be contagious. It's not likely that their siblings' illness is contagious, however. So, but I would start with listening, and I would be cautious about making explanations that are overly scientific or overly detailed. So children, I don't like to peg a specific age, but let's say children under 7 have not great understanding of what goes on under the skin. So, so I would not start talking about genetics and genes actually, I think that very few adults understand genetics. So, and we're all trying to figure out what it all means, but I wouldn't go into detail like that. I would use language that is familiar to a child, and through listening and through answering questions. So I think your child can be the guide as to the amount of information, the level of sophistication or detail of the information, and I think parents know their children better than everyone. So I think that parents will have a sense of what will work for a child. Many children don't want that much detail. So, a simpler explanation for a very young child is your sister or your brother has an illness. It's the kind of illness that lasts a whole life. It's not the kind like a cold where you get it and you get better. Sometimes she feels better. Sometimes she may feel worse. We love her. She's a member of our family. We take care of her, and that may be a good starting place.
David, you reminded me of something too. I think it's also okay to answer honestly. If your son or daughter asks a question that you don't know the answer to, it's okay to say, that's a really great question, and I don't know the answer to it, but I will find out, or let's talk about it with the doctors the next time we're visiting together. I'm so proud of you for thinking of that kind of question. I think that sort of levels the playing field in a lot of ways and says, like, this can be a really overwhelming experience for everyone, and it takes some of the pressure off of the healthy sib to know and understand all the ins and outs of what's going on.
Thank you so much. And I think both of you pretty much answered our next question from a parent that was submitted. When is the best time to explain the rare disease diagnosis with a sibling? Is there anything else that either of you would like to add around that?
Eden, I think there's this concept that it's a one-time conversation, and once we tell our kids about the things that are happening, whether it's the sibling or the child who's experiencing the medical event, that it's a one and done, and that's just never the case. That these are the types of things that are going to come up all of the time. And I always said to parents, you think that you will have had this conversation and that your son or daughter really understood every little bit about what you talked about. And then you'll be in line at the grocery store, and out of left field, they'll say something or ask a question that you will likely be very underprepared to answer, but that's okay. So I think, in addition to sort of, as David mentioned, having the conversation yesterday so that it's a part of the dialogue on an ongoing basis, but also that we keep having the conversation, because likely the plans are going to change and and more questions might arise. So normalizing the conversation and just making it a part of everyday dialogue is not the worst thing.
Thanks, Kate. Let me qualify my yesterday comment by one additional comment. Is children look to their parents to determine, they look to their parents emotionally and their parents' emotional reactions to assess a situation. And I think if it's very early after diagnosis and you're really upset about it, this took you by surprise, or you're feeling a great deal of grief at the moment, or then you may not be ready to really talk that much to your child. And I think it's okay then to wait a bit, or to say, I promise I'll talk to you more, but I just need to, do some thinking about it myself. And then about your comment about the supermarket line, where all important conversations take place, I think you'll notice that as your child matures and their capacity to understand illness develops, that the previous explanation won't be adequate anymore, and you'll have to update it. So it is a continual conversation. And again, I think answering questions is a really good guideline, because the questions will indicate what's most important to your child. But sometimes a good sit down, maybe over ice cream, and to say, let me just say what's going on with your brother or sister, would also be good at times.
Thank you so much for elaborating on that. That's so helpful. Hannah, do you recall how and when your parents told you about your brother? And if so, how did you feel when you were getting that information?
Yeah, that's a really great question. I was just talking to both of them about this to pick their brains about it. But so to be honest, I was 2 years old when all of this happened. So I don't remember anything. I don't remember that conversation. But what I can tell you is that, all of my earliest memories are, a lot of them at least, involve Ben, my younger brother, and his illness, whether we spent the first couple of years of his life at the Children's Hospital of Philadelphia. So there are a lot of connections there, where he received, really wonderful care. And so I have a lot of memories of, various support settings there. And I think that as, David and Kate were talking about, and especially this is what I'm like too, a lot of I think it's very helpful in situations that are really tricky to have more information and as much information as possible. So, my parents were, really straight with me as much as they could have been to a 2-year-old to, share what was going on. I think growing up, I always knew what my brother's med schedule was like, or when he needed to have his blood sugar checked. We had 24-hour nursing for 10 years, and there were always nurses coming in and out of my house, and I got to know them really well and ask them questions. And, I was part of that whole experience. And I think that having as much information as I could was really helpful. But again, I'll say, and I think, David, you talked about this a little bit, people are different. Everybody is different. This is my experience. But other folks may respond differently, but for me, more information is better. And, I think always being open to have conversations and answer questions is really great as a parent.
Thank you so much, Hannah. And I know that we've talked a little bit about how to communicate with siblings about the rare condition of your child. And this might take us, a little bit further in that discussion. And we know kids will ask lots of questions out of left field, like you said, Kate. But maybe Kate and David, you could help answer this question that was posed. Do you ever discuss that the sibling with a rare condition might die at a young age?
Kate, do you want to start, or shall I?
You can go for it, David.
All right. Well, let me first express a bias here. My bias is that culturally, we, at least in the United States, are terribly afraid of talking about death. And we don't even use the word death or die. We often use other words to describe it because it is so scary to us. But death is part of life. And in the case of certain rare diseases, it's pretty known that the sibling will die before the age expectable, have a shorter lifespan. And I think that it doesn't help anyone to hide it if you think your child is ready to hear about that. And again, I'm just going to go back to saying, has the question come up, and is one guideline. But if it is a child with a condition where it is known that the lifespan is only going to be a few years, I think it is important to prepare the healthy sibling. And I think, again, you look at the way that your child views the world and thinks about the world, and then I think you don't have to say death. You could just say, your sister has a condition and she's not likely to be with us for a long time, but we're happy to have her with us. We're blessed to have her with us, depending on the way that you view the world. And we're going to love her as much as we can while she's here.
Really hard conversations to feel comfortable leaning into, but that doesn't mean that we shouldn't do it, because I do think that, one of the things that makes children so wonderful is that they have these beautiful imaginations that make them very magical thinkers. But sometimes that can work to their detriment, and they've imagined scenarios that are far worse than what is happening in the moment. And so I think that's all part of why people in my profession, the work that David does, we all say, talk about it, because that is the only way to clear up the misconceptions about what is happening right now in the moment. But again, I know that I've used this word a couple of times already, but to normalize the conversation around death so that, should that time come, you've given your child some tools in their toolbox to learn to cope with some of these really difficult situations.
Thank you so much to both of you for sharing those thoughts. I think you've shared really impactful ideas, and hopefully people can learn a lot what you're sharing. And I know that several of the people who registered for today's webinar, they also submitted questions related to the impact of the diagnosis on the healthy sibling and how to manage this impact. So I'd love to move on to some of those questions. And Kate and Hannah, this next one is posed for both of you. Are feelings of anger, frustration, and jealousy normal for a healthy sibling, excuse me? And what about the guilt around being the healthy sibling? Can either of you speak to that?
I'm happy to jump in unless you want to, Kate.
No, go for it, Hannah. I'll tag team with you.
Perfect. So I think, Eden, what I'd say is all of those feelings are very valid and real, no matter who's feeling them. And I've certainly felt all of them before. I've also felt, a lot of positive feelings as well for my brother and having a rare sibling, right? So yeah, I think I'll acknowledge that having a sibling with a rare disease or really any medical condition can be really traumatic and can cause a lot of, difficulty. But again, I think there are also, to reframe your question, there are also a lot of great experiences that can come from it. So for me, I think, and not as much anymore. I don't have these feelings as much anymore. Sometimes, of course. But growing up, I think I definitely missed out on a lot of things because of my brother's illness. Whether just like something one of the conditions he has is epilepsy. And so he would often have seizures like at the drop of a hat that would disrupt whatever we were doing, or something that would come up in the middle, maybe it was the middle of a meal, or I couldn't go have sleepovers as much as the rest of my friends, or we needed to stop what we were doing, whatever it was, to just make sure that Ben's health was okay. So I think at some point I felt like I have felt like things were, sabotaged in some way by Ben being sick. But I think for me that's really taught me how to be flexible and compassionate and understanding, and how to celebrate the little things when things go well. I think for me, because of my brother's illness, I ended up getting a lot of attention, and a lot of people were paying attention to him, but they were also paying attention to me. And so I think with everything, it really goes both ways. I'll say even now, this week I'm staying, my parents had to go stay with my grandmother for the week, which is wonderful that they can do that during these really challenging times. And as an adult, I came home to stay and take care of my adult brother, who can very much take care of himself, but just to be here. And the day after my parents left, he had a seizure, and I had to deal with it, even though that's really rare right now. And that was really difficult. It's been a really difficult week, I'll say, but I think that it's also been a wonderful growing experience for us. And we've, getting to spend time together during this time has been really special for us. So again, I think it goes both ways, and those feelings are very normal, and totally okay.
I think you make such a great point, Hannah, that the feelings are normal, that jealousy and anger and frustration are feelings that every child has, whether they have a sibling with special need or not, that those are just parts of growing up. And I think you can tackle those feelings in a very similar way that you would tackle those feelings as it related to any other situation. I think for what it is worth, as I mentioned at the beginning, I help facilitate a sibling program that we run 6 times a year. And we happen to have just had one this past Saturday, and we've done virtual since all of this has started. And it definitely comes with its challenges in trying to get a bunch of 8 to 13-year-olds all on the same page to talk about their feelings as it relates to having siblings with illnesses. But neither here nor there. One of the activities we did was we asked the kids if they could trade places with anybody in the world, who would they trade places with? And one of the little ladies mentioned that she wouldn't trade places with anybody because she just loved her life so much. And I think that, that's a testament to the sentiment. She was one of the older siblings, so she was sort of able to articulate that. But when she said it, a lot of the other kids in the group sort of nodded their heads in agreement. That I think, it can be frustrating, as Hannah mentioned, and there can be feelings of jealousy, but there's also a lot of great things that can come out of teaching your healthy child what it means to be compassionate and have empathy and be kind and model those characteristics for other children, whether it be in their class or their, religious institution or whatever it may be. So those feelings are totally normal. I can't validate that enough. And it still makes it okay.
Mm-hmm. Thank you, both of you. And on the heels of that, I'll pose this next question to both Kate and David. And Kate, maybe you can just jump right in since you're the last one speaking. We all recognize that everybody expresses stress differently and navigates that. And sometimes this can present in a behavioral way. And so one of the questions that was asked is, how do you address the behavioral issues with other siblings that are trying their best to cope? Any guidance?
I think it goes back to having that open dialogue about, we know that a lot of times kids are, misbehaving because they are looking for attention in another way. And so that's just their kid way of telling us, hey, I need some attention. And so, while, getting a scoop of ice cream is not the solution to every problem and certainly won't solve all behavior issues, time, spending time with your healthy child, or taking a moment in the car and having a conversation, or reading a storybook that is what it might feel like to be worried or nervous or frustrated, can all be good ways of opening up that dialogue, and I think addressing a lot of the root of a lot of those behavioral issues.
If I could add something, Kate, I very much appreciate what you're saying. A child's behavior is a form of language, and sometimes, I would say most of the time, when you're a parent, you have a hard time translating the behavior into what it might be about. But one trick I have found helpful, because no child wants to be told, you're breaking plates because you are upset about blah, blah, blah. We hate that when we're kids. But you can say, sometimes when we're feeling really angry, or when we're feeling sad or angry, we do something. So you could start a dialogue about what the behavior might be about and what's underlying it. And often it is maybe a sense of unfairness about where attention is going from parents. I also want to say that in preparation for this webinar, I did scan the literature on siblings of children with long-term illness. And I could find really no solid evidence that having a sibling with a rare or other long-term illness is in any way harmful to children. In fact, as Kate has already pointed out, learning that you can, as a family, overcome adversity is an incredibly valuable life lesson that, unfortunately, many times we protect our children from learning because we try to protect them from knowing about adversity or dealing with adversity. But when you're part of a family who is living with a member, and in this case, a child with a serious illness, that's what the lesson is that families are superheroes when it comes to providing care for their members. And if you do come upon an article that tries to say about the terrible adjustment of siblings of kids with rare disease or long-term illness, ask someone to look at it, or take a close look, because it's often the bias of looking at children who might be showing up at a particular clinic for children who are having a problem. But I don't think there's anything. Parents should not worry that this is going to be harmful or hurtful to your well children. I think there are lessons that can be learned, and that should be part of the goal of the family and organizing itself about caring for the child with a rare or long-term condition.
Thank you so much. Great insight both of you. And on the heels of that, I think that, Hannah, you touched upon this experience just a little bit earlier about what it is like to be an adult, healthy sibling of an adult, rare sibling. But the question that is posed is, one parent of a daughter with a rare disease wrote, "Her brother has told me there's no way I'm taking care of her when I'm older. She already ruined my entire childhood. I'm not letting her ruin the rest of my life." This parent's question is really, how do I respond in a way that validates his feelings, but also could help him shift his perspective? David, since you were the last one speaking, would you like to answer this and then pass it over to Kate? And then Hannah, if you have any extra insights that you'd like to throw in there, I'm sure it would be greatly appreciated.
So I appreciate that this question is being raised, because it's really a challenging question, and it's, I think for any parent it's upsetting to think about. So let me first say that the description of this child is likely one of a teenager, because children don't really, the way that children think about the future doesn't really develop until later in childhood and in the teenage years. So to think about, well, am I going to be caring for my sibling later in life is not going to come up for a younger child. In fact, just as to offer some proof of that is, if you may talk to your child and say, well, what are you going to do when you grow up? And they'll say, well, I'm going to be an astronaut. And then say, oh, where will you live? Well, I'll live with you and mommy and daddy. The sense of the future is very limited, and unfortunately, that's why many children who are living with medical conditions, we have a hard time of explaining that if they're not adherent to their medication, for example, that it may have consequences in the future, because the future just is not viewed like adults view it. In terms of this particular young person, I would say to talk it out. And I don't think any family should make the assumption that it is the responsibility of a well sibling to care for a sibling with an illness. I think that the best chance that your well sibling will be like Hannah and have a really close and enjoyable relationship with their sibling with a chronic condition is to focus on how you model your care of your children. If your child hears complaints from the parents of, oh my goodness, I wanted to go to the beach and I can't go because of this kid, then you don't be surprised if your other children will echo that. And I think it's okay to say, yeah, I guess you're feeling pretty frustrated about the part of our life as a family. It is frustrating. It frustrates us all, but we also, we make sacrifices for every member of our family. Every single family member has needs that we need to address. We may sacrifice your needs because you play hockey and we have to wake up early in the morning to get you there. And we're happy to do that. So that's part of life, and that's part of family life. And if this is the way you feel, no one is going to tell you otherwise. These are choices that you'll make when you're older. I guess that's the best answer I could give for a very, very challenging question. I would love to hear what Kate has to say and Hannah. So I don't know if this has come up for you, Hannah.
I was going to say, David, I think it's so funny because this is actually something that comes up quite a bit in our kid group that we run. And what we actually find is that it doesn't come up amongst the kids, but a lot of the parents will reflect on that being conversations that they're having with their son or daughter, just when it comes up. And so I think if nothing else, I want to sort of offer some validation to this caregiver, this parent who threw this question out to the group. And I give you a lot of credit because I think it can be a really challenging one to answer. But know that they're not alone in this difficult sort of muddy waters of this conversation. And it does come up a lot. And I think David, you hit all of the answers on the head. It's tricky, and likely the sentiment will change many times over in the course of the healthy sibling's lifetime, from being like, well, I can never imagine living without my brother or sister in the same house as me, so of course they're going to live with me when they're older, to just that, like, no, I want to go off to college and travel the world, and I can't imagine having this other individual be dependent on me. So it takes a lot of a thoughtful conversation, I think, as many of these topics do.
Hannah, would you mind? I'm sorry, I didn't mean to bust in, but I'd love to hear, Hannah, if these conversations have taken place in your family and what your thoughts are.
Yeah, of course. So let me also echo everything that you said, David and Kate. I think that you're totally spot on. To the parent who asked this question, I've probably said this before or thought it. Sorry, Ben, if you're watching. And sorry to my parents. But I think it's a totally real feeling. And David, I read it the same way. I was like, okay, this is probably a teenager who's having some feelings, and maybe they said that one day and the next day they'll feel differently, or maybe it'll take a couple of years, or maybe it won't change. And I think, again, those are very valid feelings to have, and it's okay. And I think I've gone through times where I didn't always feel so positively about this, and where it was more challenging for me, of course. David, I think your points about just being a supportive family member and everyone needing something are really spot on. And the only other thing is I'd kind of flip it to, as a member of the family, yes, I am, the quote unquote well sibling, but I need different levels of support. So how does my brother with a rare disease support me, right? Because he does. And I think it goes both ways. And again, just hearkening to the fact that everybody needs different levels of support for different things. And, as a family, we all support each other in different ways. I think that's probably how I would frame it. But again, whoever asked this question, I think things will probably change. And it's okay that the sibling is feeling like this right now.
And Hannah, too, I guess I would also like to piggyback, and I think it's also okay if the sibling doesn't change their mind, if they don't want to be the caretaker, right? Like, that's okay. That's not, that they weren't born in, you weren't born into this life to be Ben's caretaker. You were born into life to be Hannah and succeed at all of the wonderful things that you're doing in this world. And I think that that's true for a lot of the brothers and sisters, that at least the ones that I find that I support, that if they have that feeling, to your point, validating and say, like, that's okay. You don't have to be, mom and dad or our family caretakers, and are gonna support our family getting with it what it needs.
Thank you, everyone. Oh, sorry. Go ahead, David.
Do you mind if I say one other thing? And I could imagine that some teenagers or children may feel more angry if they're asked to do a lot more for their ill sibling. And although most times I think the kids will feel very proud of the ways that they help and support their sibling with a rare disease. But I would caution against asking children to provide personal care to their sibling. I think that can provoke a kind of reaction like this young person may have said, which is if they feel like they're asked to do things that are overwhelming for them. So I think most families do not do that and understand that naturally, but families that are very stressed out, or when there's a lot of problems going on, or that sometimes that does happen, and sometimes you can't prevent it. But I think that that being supportive and being helpful to a sibling with a rare disease is probably going to be beneficial to your well child. But there is a point at which you should be careful not to cross, which is too much responsibility and particularly personal care. So just to add that.
Thank you, David. Really on the heels of that, and building off of the the previous questions, I would love for us to go a little bit deeper into planning and preparing for the future. And with that, a lot of questions were posed around this. And so Kate and David, David, if you would like to continue speaking, the question that was posed is, how do I respond to questions about the future when I really just don't know what that can look like?
Well, thankfully, we've all had some training experience in an uncertain future, because a year and a couple of months ago, I don't think any of us would have been prepared to stay home for a year. So as an example of that, that the future, even under the best of circumstances, without any rare disease, is very, very difficult to predict and very difficult to prepare for. So I'm going to go with Kate's suggestion, is to be very clear that we don't always know what's going to happen. We don't know what the future will bring. We just focus on looking after each other as a family, and we in some cases we may be needing to prepare ourselves that your sibling's condition may become worse, or they may become more ill. But if that happens, then we'll reorganize, and we'll figure out what we need to do to take care of the child then. I think that this is also a really good question, because we don't know what the future will bring. I don't think we have to make believe that we do and present ourselves as owners of crystal balls for our children. I think we could share with them that we often face uncertainty, but we have the faith in ourselves and as a family that we'll adapt to whatever life throws us.
Yeah, and beautifully said, David. I don't know that I have much to add other than just to say that I think we teach our children more resiliency when we teach them that we don't know what can happen and we don't always know what to expect, but that we know that we can handle it, whether that's as a family or as an individual. And I think we would be doing them a disservice if we sort of said that we could predict the future. So, I think it's better or more important to sort of admit that we don't know what's going to happen, and that we're just going to do what we've always done and keep at it. Easier said than done, of course, but.
Easier said than done for sure. And our last question under this subtopic really is on the heels of this piece of we don't know what the future is going to look like. And you both have talked a lot about resiliency and working together as a family unit, and also identifying, family unit, but then in an individual level. But thinking about the family, how do we as a family handle the impact when a rare disease sibling dies? I'm sure the person who posed this question would just love to hear some of the insights that both of you have. And Kate, if you want to start, that would be great.
Sure. Yeah. I mean, I think this can be really immensely challenging for families and for siblings, certainly. And again, this isn't the kind of thing that there's a cookie cutter answer, and what works for one family will work for the next. I do think that, doing what you can to create legacy prior to something happening is always really important. Whether that's taking lots of really great family photographs or, making home videos, whatever that looks like for your family, to just really embrace the legacy of the child with the rare disease who passes away, who dies, and that. Including that there are so many great resources out there, whether it's bereavement groups or family support groups. And I know that individual rare diseases, subsets have their own support systems. And so I think, feel okay asking for help. I think that's the best advice I can give is that, people will often not know what to do. And so it's okay to ask for help. And there are plenty of people like myself and Eden and David and, the NORD organization who have resources that are available to us in our roles that can be supportive.
If I could add to that, there's a wonderful organization that is really focused on, it began as an organization for parents who have lost a child with a rare disease, and it's called the Courageous Parents Network. Courageous Parents Network. And I think that the link will be sent out in an email. That is a wonderful source of information and support for families facing the loss of their child to a rare disease. And they also have great information for siblings. So they have a whole unit on siblings with a number of videos that are really beautiful to watch of siblings talking about their ill sibling with a rare disease. I would say about how parents might help their well child on the death of the child with a rare disease is, particularly for younger children, I would try to narrate your experience and explain how you are reacting. Because I think young children may not fully understand how to interpret your behavior, and putting it into words is going to be helpful. A lot of talking about it, and then trying to, as you mentioned, trying to include your child in some connections with other families who've had this experience. And that could be through NORD, through Courageous Parents Network, through the organization that you're connected to. So for example, National Tay-Sachs and Allied Diseases Association at their meetings will have a kind of memorial meeting where children who have been lost to those conditions are remembered. And families have different ways of remembering that are particular to the family. It may be part of your culture or part of your religion. And I think at these times, those can be extremely comforting, both to adults and to children. But again, I think I would narrate what you're doing and why you're doing it. I think children don't really understand funerals very well, or what the prayers are, et cetera, or the statements that are made. And I'd like to add one thing, is that there is no one way to grieve. And I think there is a model of grief which is fabulous and brilliant, and people are familiar with it by the name of the author, Elizabeth Kubler-Ross. But that and she wrote about the stages of grief. But A, we don't know if that is experienced by children at all. And B, is people overinterpret it to say that you need to go through the 5 stages of grief in order to heal. And that wasn't the intention of Elizabeth Kubler-Ross. And no one should be saying, this is how you do it, or this should take only a certain amount of time. And I think most parents will grieve a lost child their entire life, and they should never be told, oh, you should already be over it because you've passed the period of time designated by this article I read. So I would encourage families to think about doing this in your way, in the way that is most healing and nourishing to your own family. And get help from people like Eden, from organizations, but also think about what you need as a family and practice that.
Thank you, David, so much, and Kate. And we're almost out of time, but before we wrap up, Hannah, I'm going to pose this next and final question to you. How do I support my sibling who has a rare condition, and then as a child and as an adult? If you have any insight or suggestions, I know you have highlighted that a little bit along the way here, but any resources or suggestions you have to help gain some insight would be so welcome.
Yeah, absolutely. I think up top, for me, the question is, how can you support anyone that's going through something challenging, right? Like, again, this can apply to anyone. And so I think it's just thinking about how to support a human being, but also, I guess, more specifically about having a sibling with a rare condition. I think one thing that has been great for me and my family and my brother is just educating as many people as we can about the condition, especially, growing up. We're lucky enough to grow up in a pretty small community and go to public school where you got to know each other, your classmates very quickly, and there just weren't that many people in the town. But I think something, having something that's different about you can make going to school really challenging. And so over the years, and Ben my brother has done this too, we've really tried to educate people about his rare disease and rare diseases in general, and to just kind of explain what he's going through so that everybody around him understands that. To the point where, we've gotten all of our friends involved, and now a lot of my friends are in the world of rare diseases because they learned about Ben's condition. So I think education is a really powerful tool, and just, again, supporting and treating your sibling with compassion is, the biggest thing you need to do.
Thank you, Hannah. Thank you again to all of our speakers. And now that we're at the end of our time, I just want to say again, thank you for the panelists and all your insights. And I would love to remind everyone that we'll be sending out the recording to everyone who registered for this webinar. And you are more than welcome to share this with anyone who you might think find it helpful as well. Thank you to all of our speakers for sharing your expertise and experiences with us today. And I'd like to extend a special thanks to each of you for joining us and for tuning in. You'll be receiving a short survey about this webinar, and we encourage you to complete it. Your responses will certainly help us to develop future programs. Thank you again for NORD for hosting this, and thank you for joining us, and enjoy the rest of your day. Take care.
Thank you again for joining us today, and thank you to Identities, our supporting sponsor for today's webinar.